Exactly.
All right, we're going to head outside with Mary now. She's with our guest who will show us a great workout that will target your back.
Yeah, and talk a little bit about it, because Aaron from TOSH here is a back expert, a spine expert. So we really, and everybody suffers from lower back pain. Something's going to bug them, right?
Exactly.
And how do you strengthen your back?
Well, there's a few components we have to discuss first. First of all, there's no one person that's the same. Everybody's different. No back pain is the same, so everybody has to be treated differently. There are some key components that we need to consider with back problems, or things we can do to prevent. First of all, being aerobic exercise.
Right.
You know, we all hear aerobic exercise for any health problem. Some of the key components of aerobic exercise: doing something at an intensity moderate enough or hard enough that you can keep your heart rate into a range, but not too high.
And you don't want to be jarring your back. You want to do something. Let's show some exercises that can strengthen, just so we can do aerobic exercises.
Well, let me talk a little bit about some of the anatomy of the spine. First of all, there are 4 abdominal muscles. There's the rectus abdominis, the internal and external oblique muscles, and then a deep muscle called the transversus abdominis.
Okay.
The transversus abdominis has been implicated in those that have back pain.
Okay.
Those that have back pain don't use this muscle as well as those who don't have back pain.
Okay, and
so,
what's an exercise for that? This is
one
that you've given my daughter to do, I know.
Exactly. some of the basics. First of all, learning how to contract that muscle without firing all of the others. So this could be an exercise that would be applicable for the person that's barely starting an exercise program, or someone who is doing high-level Pilates. It's a combination of a pelvic floor contraction, so you've heard of Kegel exercises. It's basically like you're trying to stop the flow of urine.
Okay.
And a combination of drawing your belly button to your spine or down to the table.
So below the belly button there.
Exactly.
Yeah.
So there's no movement that should occur in your spine. It's just drawing in. This is an exercise that I have people do on an hourly basis throughout the day, or right before they do any activity that's potentially strenuous for their spine.
It's hard to show, isn't it?
It is a little hard to show. Now, one of the things that after we've taught this exercise, this is the basis behind every other exercise that we show a person.
Use that while you're doing it.
Exactly. So from there you can do your crunches, you can do your planks. Some of the basic exercises that we would show people would be a simple marching for a beginner.
That lower ab.
Exactly. While you're holding that muscle.
Right.
You could do an exercise where you're drawing in. You press with your hands and hold it for 5 to 10 seconds.
Okay.
And then let go, and then let go of the brace.
Well, Aaron, we're already out of time.
Sequencing.
Here.
You bet.
Okay, now, you guys, Aaron is the one who helped my daughter get back to 0 pain from a bulging disc in her back, and it took 2 weeks. And it was these kind of exercises that helped that pain just go away. So
Yeah, they say therapy like that does help a lot.
Yeah.
And consider that definitely before surgery.
Right, absolutely.
Anything before surgery,
Yeah.
right.
All right, thanks a lot.